I'm glad that you've joined us today so we can talk about an exciting new procedure that we're doing here in our clinic. It's commonly called the vampire lift, which sounds a little scary, but a scientific name for that is platelet-rich plasma. What we're doing is collecting blood from our patients, thus the vampire part, and then spinning it down and through a special procedure concentrating their blood to just have plasma and 5 times more platelets, your own platelets, that are then re-injected back into your skin. You might say, well, why would you do such a thing as that? Well, there's some very compelling evidence that by doing this, concentrating the platelets and re-injecting it into your skin, you can have significant growth factors stimulated in the skin and really get an enhanced dermal layer, more collagen, more blood vessels, healthier skin. It also causes a signal to go out and makes your own stem cells migrate into the area so that the stem cells can stimulate the growth of new skin, new, healthy, young skin, like you've never really had before. This procedure is not new. It's been used in orthopedic surgery and dentistry. It's being experimented with in hair restoration. There's a variety of areas that this is being used in as a safe alternative to stem cell therapy, which is difficult and expensive. With this, we're able to stimulate your body's own production of stem cells and growth factors in your skin. So what's the vampire lift part all about? Well, we've been doing fillers in our office for a long time where we would put Juvederm or a hyaluronic acid product into your cheeks or nasolabial lines, maybe into the jowls here, the lips. Anywhere that you need to put a filler, we can use that, and we can follow that up with the platelet-rich plasma. So when we think about doing our procedure, what we're doing is first analyzing the patient to see what their needs are. In many cases, it's about lifting and enhancing the cheek area, the malar fascial area. We're thinking about the nasolabial folds and the marionette lines here. We want to increase volume overall and make the skin look better and healthier. The first thing we do is to draw the blood. It's a very simple procedure, and it's just done with a simple tube like this, just like you would have your blood drawn for a common laboratory test. We normally take 2 of these and draw the blood off, and then through a process in our laboratory, we isolate the platelet cells and concentrate them for you. I will then, after numbing your face, go ahead and inject with our hyaluronic acid product, typically Juvederm, which has an anesthetic agent in it, and then come back with adding the platelet-rich plasma. And when we do that, we're going to overfill a bit, and so our patient might actually look a little bit swollen, a little bit more red. That lasts just a short period of time, and usually by the next day, most of that is gone. There's no significant change in the way we do this from our other filler techniques, and the patients are numbed up and for the most part pretty comfortable when they do this procedure. The nice part is that over the ensuing weeks and months, there'll be a regenerative process to the skin as a result of the platelet-rich plasma that's been injected back into your skin. So what we have here is we have a combination of a traditional filler procedure using Juvederm or Radiesse if necessary for a longer lasting effect, and the addition of platelet-rich plasma, a safe, effective way of stimulating your growth cells in your skin and stimulating migration of your own stem cells into your skin to promote growth, collagen growth, new blood vessel growth, so that you have a more glowing, healthy, and thickened skin. We're very excited about this procedure. The platelet-rich plasma is available for you, and we can do this in any area of your body that needs rejuvenation.